Hey, I'm Dr. Jen Tyra. I'm an orthopedic and pelvic floor physical therapist, and today we're going to talk about pelvic floor dysfunction. So your pelvic floor muscles are ones that many people kind of forget that they have or they aren't even aware of, but these muscles live inside of the pelvis, and when they're nice and healthy, these muscles should contract and lift up, but they should also be able to relax and go back to their normal state of resting. Some signs that you might have a pelvic floor dysfunction include pain with intimacy, pain with a gyno exam, or leaking while you're coughing, sneezing, or exercising. Now, have you ever been told that this is normal? Too many times I have heard doctors, physical therapists, or personal trainers tell their clients that it's just normal to have some leaking as they age or after having babies, and that they should just go home and do some kegels. Well, I have two problems with this. Number one, again, it's not normal. That yes, it is common to have pain or it's common to leak, but it's not actually normal. And I don't want you to think that you have to just live with this issue. But number two, kegels are not always the answer. So when there is a pelvic floor dysfunction, your muscles could be overactive or underactive. When the muscles are underactive, this means that you're having a harder time contracting the muscles or activating them. And while they're overactive, if you have an overactive pelvic floor, it means you're having a hard time lengthening the muscles. So individuals who have an underactive pelvic floor, it often is a good time to do some kegels in order to strengthen the muscles. But the problem with just telling the patient to go home and do that is that they did a study and they found that 40% of women actually did kegels incorrectly when they were just instructed to do it. On the other hand, for women who have overactive pelvic floors, the muscles are already contracted. So doing more contraction can often just make the pain or the problem worse. So if you've been doing kegels at home and you're still struggling with things like pain with intimacy or leaking while coughing or sneezing, this is a good time to contact a pelvic floor physical therapist. If you just send me a message, I would love to chat and talk about what we can do for you.